Hello and welcome. I'm Barkha Dutt and you're with The Mojo Story, our independent digital platform that does a deep dive into the big stories of the day. On National Immunization Day, what could be a better day to take a closer look at India's COVID vaccination rollout? What's it looking like? Well, it's actually looking much improved. We're now more than 30 million vaccinations down, making us the second largest in those numbers now globally, up from the number 4 position just a couple of weeks ago. But we have to keep in mind that we're talking about a huge country, and we're still talking only about 3% of Indians vaccinated, even at that more than 30 million vaccinated number. And now remember, India has set a target for ourselves, and we are aiming that by July, the government is looking for 300 million to be vaccinated. We had a record of sorts on Monday when 30 lakhs were vaccinated in a single day on the 15th of March. That is a record, and that's actually probably the number we need to keep at, or actually even improve from and escalate from, because like I was saying, there is a target here, and India is still 267 million short of that target, which has to be achieved by July. That's the target the country has set for itself. So there has been a lot of improvement, but some would say that the vaccination space needs to be opened up completely. All restrictions need to be lifted. You need to have pretty much a walk-in concept, and all of this is happening as European countries are putting a hold on the AstraZeneca vaccine amid fears of blood clotting. Is there anything to that at all? Remember, there have been no such complaints at all about Covishield in India. And I just wanted to flag that, because we don't want to be contributing to any kind of rumor mongering around these vaccines. If you have a chance to taking the jab, please go and take it. But why are some European countries responding like this? To look at this and also to look at what's happening with the cases, let's introduce our panel of experts on the program today. Let me introduce them all one by one. We're joined on the Mojo Story by Dr. Shahid Jameel, who's one of our best-known virologists. Thank you, sir, for joining us. We have Dr. Arvinder Soin of Medanta Hospitals. We have Dr. Rajeev Jayadevan, who's with the Indian Medical Association in Kerala. And we have Professor Shamika Ravi, who literally I follow on Twitter as that single source person for the computation of data, both for cases and vaccines. So before I actually get the doctors in, Professor Shamika Ravi, I do want you to do a little bit of the breakdown of the numbers for us. And, we looked at some of them, but how's it looking?
It's not looking too good at the national level, Barkha, because we are back to active cases increasing at a rather high growth rate, which is about 3.3%, and which is quite sharp. Now, overall, the numbers might still be low, but we are averaging now 25,000 a day, which is not good at all. But beyond the national level, when we break it down, then specifically the states that are contributing, there the surge is far more severe. Yeah,
but let me be a little contrarian here. Do the cases matter anymore? Because what the vaccines were meant to do was, the vaccines were not going to necessarily just stop the cases. The vaccines were going to prevent these cases from moving towards mortality. The vaccines were going to prevent these cases from moving towards hospitalization, right? So when you look at these numbers, do you think you should be looking at mortality and hospitalizations instead of just the testing positive when you do your number crunching?
No, absolutely. In fact, the cases, while they're still surging, if you look at the case fatality rate, then it is consistently coming down, even now. And we are down to 1.4%. Now, remember, globally, there has been an increase in the CFR, and largely on account of Eastern Europe, and we haven't seen any increase at all. So I think that's a good thing. But also we are in a peculiar situation, Barkha, because unlike most of the OECD countries, which is what most people are tracking, vaccination drives have started simultaneously with them reaching new peaks. So while the cases were really surging is when the vaccination drives began. Our case has not been like that. We, in fact, started vaccination drive when we had very much peaked and had seen several months of sustained decline. So I think, sometimes just simple comparison don't quite, it might be far more alarming than required.
Yeah. Let me bring this to Dr. Shahid Jameel now. Dr. Jameel, there were calls earlier for bringing the private sector into the space. The private sector is there now. But do you think the kind of caveats that still exist, for the vaccines under 60 or above 45 with comorbidities, do you think these have to be knocked out? Do you think we need to do way better than even the 30 lakh vaccinations a day record that we actually hit on the 15th of March?
So, Barkha, the problem has really not been supply of vaccine. The problem really has been people registering to get a vaccine. I'm sure you are tracking this, and you haven't really seen, long lines of people waiting to get a vaccine and returning home without getting one.
Yeah.
It's the other way around. There's this old caveat that vaccines don't save lives; vaccinations do.
Yeah.
A vaccine in the freezer is useless. The vaccine has to go in the arm. And that's where I think we need to be concentrating. Ever since India started vaccinating people in my age group above 60, in the last 10 days, we have had 1 crore people getting vaccinated.
Yeah.
So that's a pretty good rate. Yes, the numbers in India are enormous, and anything is challenged by numbers. But I think the focus really needs to be on getting more people to register to get the vaccine.
So is the problem that the laws are not expansive enough, or do you think there's still vaccine hesitancy, Dr. Jameel?
Oh, there's vaccine hesitancy. I have doctor friends who have not taken the vaccine.
Really?
Yes. And I have severely, I've come down heavily on them that, how can you be doing surgery and not taking a vaccine? This has happened.
Do you think it should be just a controversial thought there? Do you think it should be mandatory for health workers at the front line to take the vaccine, Dr. Jameel?
Well, if it's mandatory, then we will start shouting, big brother, dictatorship, this, that. No, I think it's perfectly fine the way it is going. But we need to really educate people, and that's where trust and transparency comes in. Don't hide data, don't cherry pick data. Give it to people as it is, and that really builds trust.
So before I take that to Arvinder and Rajeev, Shamika, because you're the data person, is there something about the data that we need to know that we don't know? For instance, when we talk about the surge, do we also have to maybe add on, and you'd be the best at this, that there are 6 states that are accounting for more than 70% of the cases in the last 24 hours. So it's not pan-India, 1. 2, the fact is that even in these states right now, Maharashtra is doing terribly. So there's a bulk of the surge happening in one state, right? So when we talk about the data, not cherry picking, but certainly dissecting it and deep diving into it, what's the story that the data is telling you?
It isn't just those particular details, Barkha, what you outlined, that needs to be communicated. I think in a situation like this, public communication is very, very critical. And it isn't just with respect to the vaccines, but generally in terms of the infections. Now, talking about national averages for a country of 1.39 billion is rather meaningless when you're talking about individuals who are apprehensive, or states that are facing either registration problem, delays of supply, or is it really a hesitancy issue? So we are talking about an entire continent of sorts, and national level data, I think, hides more than it reveals. So what you're talking about, state level specific, I think while that might be good, that might still only take us to a competitive sort of different governments. It's what one government says versus another, and I think this is the objectivity of data, that you need to put out a comprehensive list of statistics on at least a weekly basis, and I think that effort truly has been lacking, from all levels of government, and I think that has contributed to the confusion and the fear.
I think that's a good point. Dr. Arvinder Soin, if I can get you in now, the fact is that if health workers are going to be hesitant, how are you going to, actually convince everybody else? And I personally actually think that frontline should not just have first access, but frontline is probably morally obliged to take the vaccine because you're at the front line and you are therefore potentially exposing others. Can you unmute yourself, please? You're on mute, sir. Sir, you're on mute. Yeah.
Yeah, I absolutely agree with that, Barkha. There should be no hesitancy either among the healthcare workers or among any other kind of people as well. Because, I mean, what have you got as an alternative? Is it COVID infection? And COVID infection is preferable to actually having a vaccination that will work almost every time in preventing severe disease or death? Obviously not. So I can't understand this vaccine hesitancy at all. And I've been actually promoting everyone getting the vaccine, including my own institution. And, besides that, I think it's now, like you said earlier, we need to expand the horizon. We need to get more people into the vaccination drive. We should, right now it's only about 45s and who have comorbid conditions and about 60 otherwise. But I think in Ludhiana, they've actually allowed the journalists and the bankers and lawyers to actually get vaccinated. And, the paradox is that the school children, the college children, and the workforce, the adult workforce under 50, are actually largely going unvaccinated. And that's crazy. So I think it should be opened out to everyone that who's willing and able to get the vaccination to get vaccinated, because eventually we're aiming for herd immunity, right? So just focusing on certain sections of people is not going to help. And I understand that initially there were concerns about shortages of vaccine, but right now, like has been said before, it's not the shortage of vaccine, it's vaccine hesitancy and restriction of the target groups. So I think it should be opened out for sure.
Okay, let me just quickly get Rajeev in, and I do want to spend some time then talking about how the doubts around AstraZeneca in globally should not actually percolate down to India. Rajeev, very quickly, what are you seeing in the South? Sorry, I just need to unmute you and then go ahead. Yeah.
In the South, the vaccine hesitancy has improved, has become better. But I must admit, I do have doctor friends, uncommon ones, who have refused to take the vaccine. So that takes us to the discussion here that the human mind is not as rational as we think it is. We think we are clever and we make decisions based on facts. That is false. The human mind is an emotional computer. It responds to emotion, so it does not respond to facts. So when the longer and the more we discuss problems about, say, adverse outcomes following vaccination, I believe the worse the community hesitancy would become. It's always a case of, I told you so. The vaccine hesitant people are going to say, look, I said this is going to happen. Now, if you were to look at a script that we made even before the vaccines were released, this was part of the script. What is playing out in Europe is something we described last year. See, people are going to get sick. People are going to die regardless. Vaccine is not a cure. It's not going to stop DVT from happening. It's not going to stop people from dying of other causes. But the general public and a section of the healthcare community is not able to understand that. So, which is why I said we must be very careful what kind of data we reveal to the public. For example, the CDC's data is now being used by anti-vaxxers as evidence of deaths. I use quote unquote evidence of deaths. See, adverse effect following vaccination is not the same as adverse effect.
I agree with you, and which is why this conversation around the AstraZeneca vaccine is so important, because not just is it going to bolster the fears or the rumors that are being propagated by anti-vaxxers, it is probably going to increase vaccine hesitancy even in countries like India, where there are no reports of this blood clotting. So I want to bring in Dr. Jameel on this very important point, right? The European nations that have halted AstraZeneca. Now, AstraZeneca produced in India is of course known as Covishield. The vaccines here that are being spoken of have not been produced in India. That's the second thing that I want to underline. And there have been only 30 reported cases of clotting after 5 million doses of AstraZeneca. Just look at that math. It is, to me, I'm not a doctor, I'm not an expert, Dr. Jameel, but it looks absolutely nutty that on the basis of those numbers, you've actually taken a vaccine out of circulation.
Yes, absolutely. I mean, if you read today's Guardian, there's an article written by a professor in Cambridge who possibly understands this much better than I do. And he says that the rate of clotting is about 1 in 1,000. Oh, I see it's there on your screen as well.
Yeah.
So just by random chance, the only way you can find out whether this vaccine or that vaccine is causing more clotting is in a clinical trial when you compare it to a placebo. And if you look at clinical trial data for these vaccines, there is no evidence from there that there is significantly more clotting in people who got the vaccine versus people who got a placebo. So this is really unfounded. As far as India is concerned, I have talked to the top people who are managing the adverse events following immunization. And the information I have is that in India, there are a total of 234 hospitalizations in people who got the vaccine.
234.
234.
Okay.
There have been 71 deaths. Now, these deaths are not related to vaccine, but these are in people who took the vaccine.
Right.
And in none of these hospitalizations and deaths, any deep vein thrombosis has been seen. So that's the information about India. So
but can you break that into data? Because you're talking about 30 million, more than 30 million people vaccinated, in which there are 200 plus hospitalizations, 71 deaths, which there is no evidence to link to the vaccine directly, right? So it just takes me back to this conversation around AstraZeneca. Are you worried that with European nations pulling the plug or at least pausing the button on AstraZeneca, this kind of rumor mongering is going to filter down to India? People are going to say, "Arey, ye to India mein banti hai." See, people also don't understand. The number of people who think now, who've gone from Covaxin is unsafe to Covaxin is safer. There's a lot of Google knowledge, layperson knowledge being applied here, Dr. Jameel.
Yeah, absolutely right. Even the European Medicine Agency is saying there is no link. There are a few European countries who have temporarily stopped giving these vaccines.
Yeah.
So unfortunately, bad news travels much better and much faster than good news. And like it was said earlier, I think Rajeev said this, that it's the emotional mind rather than the reasoning mind that's working here.
Yeah. Shamika, do you want to add to this? And when you look at the data and you've talking about the resurgence in cases, of course there's pandemic fatigue. And actually it's understandable, right? You cannot shut a country or the world down for more than a year. That's already happened. Is there another way to do this? Is there another way? I mean, frankly, my way would just be to say mask up and live, get the vaccine if you can, and carry on.
Well, I think that trial and error, Barkha, is already happening across the world, right? Most countries are experimenting. As you saw in the European case, in fact, they opened up very soon. And in our case, the lockdown lasted much longer. Even unlockdown, which happened in phases, you saw that economic activity, mobility did not really shoot up. While in all of Europe, it did shoot up right after about a month or so after the lockdown. But then
I have to make exception for cricket stadiums where you can't keep Indians away from, where the BCCI has now had to sort of step in and say, we're not getting the spectators into the stadiums.
So that trial and error, I think, is happening everywhere. But on the large front, remember, there is a lot of vaccine nationalism that we are seeing globally. I think the jostling that you are seeing across different countries that are keen to promote their own candidates, I think we haven't yet had a very serious discussion globally on those elements. And I think the fact that some of the rich countries, and US in particular, has cornered a very large amount of resource in terms of just the AstraZeneca doses, and has not even given emergency use permit, is licensing is happening at the same time, while many African countries are clearly underserved, even for very vulnerable populations. So I think many difficult conversations have not begun to happen yet. And the problem is really political now, Barkha. It is no longer a health problem, because the solution is
Explain that. Do you believe that the European countries, and I think Shahid was talking about this before we started the show, do you believe that the European countries, in part, the jostling is going on within Europe, is about vaccine nationalism? There is every country wanting to say, including India, and it's a natural thing, we made a COVID vaccine. We produced a COVID vaccine.
Oh, absolutely. And I think eventually the constraints will be the production capability, the manufacturing capability, and the fact that many of the OECD countries have already had pre-orders, which are multiples of the population. So I think this is where global leadership, the fact that negotiations, the role of WHO. So WHO has still not come out and said anything against the AstraZeneca vaccine, and yet you're seeing countries move ahead and say we have more stringent regulatory norms, and therefore we are happy to take it off the shelves. I think there is considerable amount of politicking, which we are likely to see in the coming months.
Before I go to Arvinder on some of the medical dimensions of the vaccine, Dr. Shahid Jameel, if you want to come in on this, because there have been two controversies with AstraZeneca. One is, of course, what's happening with the European response, and the other is the gap, the number of weeks that should be spaced out between the two vaccines. I know we were talking before the show started that you've got a jab, and you're not very concerned about this debate around how many weeks you need between the first jab and the second. So speak to both of these controversies.
Well, if you look at the data on the 12-week vaccination, this is a Lancet report. It's a meta-analysis of 4 different trials that Oxford AstraZeneca has done. This includes the half-dose, full-dose trial, which I really consider a botched-up trial, and it should not even be included. If you look at the data specifics, they don't make sense a lot of time. The confidence values that have been put, the ranges are too wide. So there's a lot of problem with data. My simple point is, this is really designed for countries where there is a shortage of vaccine doses. So you can give one dose and protect people while they wait for the second dose. So you can give the first dose to many more. In India, we don't have that situation. In India, I think we should simply go with 4 weeks, maybe extend it to 6 weeks, but not more than that, because parts of India are seeing a surge. This is really the only opportunity in history we have to curb a pandemic using a vaccine. It has never happened earlier.
And because you think that gap is a non-issue, the gap between the two, you're saying the first jab is actually enough to offer some protection. The Europeans pausing the AstraZeneca vaccine, do you think that's Brexit versus Brexit politics playing out there?
Well, I think there is politics playing out there. If you really read this Lancet paper, in the summary of the paper, they make this categorical statement that this schedule should be followed if vaccine doses are in short supply. It says there in the article. So even the recommendation by the authors is, in a sense, use this strategy if vaccines are in short supply. We don't have that, so we should not really.
So that's an interesting point. You're saying we don't have that. I want to know from practitioners, is there a demand-supply mismatch, right? Like we saw initially a lot of vaccine hesitancy, Dr. Arvinder Soin, but I also know of people who want the vaccine, and the younger workforce point in particular you made, I think most of us would go and get the vaccine if we could, but we're not above 45 with comorbidities, or we're not above 60.
So I want to make a little point about the discussion you've just had, and that's about the timing. In the same Lancet paper, in which it says that it's more convenient to actually space out the doses when you're running short of vaccine doses and you want to vaccinate a large population, without spreading out the vaccine drive too long. It also says in the last sentence that spacing out the second dose may be better it may protect better against COVID infection. So actually, if you see the interpretation in that paper, it's both. It's also, apart from the logistics, it also helps increase the protective value. So having said that—
Which they discovered by accident. Which has been discovered by,
absolutely right. So that trial was not actually designed to find that out, right? But just because they had a few patients, a section of the population that was vaccinated late, so they looked at their data. Agreed. Now, in terms of the question you actually asked me was, should the younger population also be included in the ambit of those who are going to be vaccinated, right? And I actually think that whoever is able to and is willing, the vaccination should be opened up to them. Now, I don't exactly know what's the current vaccine situation in terms of the number of doses the government has to distribute. But I would have thought that initially the plan was 1.6 billion doses, but majority of that was going to come from Novavax, which is not yet started. And the rest of it was going to come from Covishield and Covaxin, which is already there. So I think they could at least ration some of them for the high-risk population and the elderly population, whereas the rest of it could be distributed more openly. That's what I feel.
Yeah, Rajeev, what are you finding on the ground as practitioners?
That I had done from Cochin. It was a study on the post-vaccination, immediate post-vaccination experiences of 5,396 people. And myself, Dr. Ramesh Shenoy and Anita Devi had done the study. It was the first in India to look independently at post-vaccination experience. And we found that pretty much what we would expect. People were getting mild side effects as expected after vaccination because of innate immunity, that is in the day 1 and day 2 following the vaccination. And younger people were getting more and older people were getting less. Women in general got a little bit more and men got less. And there were no serious outcomes reported in the survey at all. And I keep talking with people who are administering vaccine on the ground. I'm happy to hear from Dr. Jameel that that is indeed the case. And none of the senior vaccinating officers who are in charge of the state here have said that there are any increased instances of thrombotic or embolic events at all. So the point here is India is between waves. See, we say when you lose a job and you look for another job, we say we don't say I'm jobless. I say I'm between jobs, right? That's the best way to say it. India at this point, we are between waves. Most nations that we are closely monitoring have had 2, 3, perhaps more waves, and this is the time to vaccinate people. Having a raging pandemic is not the time to vaccinate people because you're gonna have strange outcomes after that. So this is the time to accelerate the pandemic, erase whatever hesitancy there is, and if somebody really does not want to take it, it's their choice. All the information is out there. We've been communicating even before the pandemic started, and this is good. It's good we're having this discussion.
Yeah. Good to hear all of this. Let me give the last words to Shamika and then Dr. Jameel can wrap it up for us. In terms of policy intervention, do you think that it is time for the government to basically say anyone above 18 and, go get vaccinated? We don't have, as Arvinder said, a clear sense of the demand supply, but I have not yet heard any complaints about vaccines running short at centers.
That's true. In fact, despite the back and forth between some of the state governments and the center, Rajasthan, Maharashtra did have claims of shortages, and then you heard from the central government that they were in excess supply, etc. I think the constraint right now is truly in terms of the registration process itself, and which means that even people who are within the eligible criteria are finding it a little bit problematic to really register and get a date. The second is clearly opening it up to a much wider population, perhaps not all the way down to 18, because remember, while production is no longer, it isn't as much of a constraint for us, but it still is a constraint. I mean, between the two manufacturers, we have to work through the timeline and the sort of the supply chain. So I think expanding the eligibility criteria is a good idea. I think making registration process a little easier, working on the back end, the tech. I really think tech should never really be, it should be an enabler and not a constraint. I mean, that is the whole idea. Yeah. Those, I think, are smaller, tweaks that can be done rather quickly. And I actually disagree on the fact that leave it to people. I think vaccines really have to be made mandatory. Simply because, remember, there are negative externalities to not having my neighbor vaccinated. Right? So, if it were ailments which are not contagious, then I have a right to not get vaccinated. But when you have highly infectious diseases, and that is the whole problem with these nature of, these kind of diseases, the negative externalities mandate that we really, if you fall within the eligibility criteria, then I think it is.
So you're saying there should be a rule book. If you qualify, you've got to get it. Otherwise, you're being irresponsible to people around you.
Absolutely.
That's an interesting thought, Dr. Jameel. You said it would be called Orwellian and dictatorial if that were imposed. But as an expert, you see, there's another problem. One is the health. The other is we've got to get our economy back. We've got to get our lives back. And none of this is going to happen till a critical mass is vaccinated. And therefore, if people are just going to falter and be hesitant, it's going to pull a country back, right? It's also that.
Yeah. So I really feel that I do agree with Professor Ravi that the tech at the back end has to be made simpler. And I can say this from experience. I was trying to register on the first day that the site opened, and it was a real challenge. I believe things have improved since then. But let me come back to what a vaccine in a pandemic situation should really do. There are three things that you desire of a vaccine in a pandemic. One is to protect your frontline workers. That's the healthcare workers and people with maximum contact. The second is to reduce mortality. And that's where the 60 plus comes in, and people with comorbidities. And the third is to break the pandemic. So right now we are focusing on the first two. But yeah, I agree. If supplies are not an issue, then open it up. But I would still not agree to making it mandatory.
Why not? Why not? Why not?
Because the moment you make it mandatory, all kinds of conspiracy theories, and you will get more vaccine hesitancy coming in.
Shamika, do you want to respond? Shamika, do you want to quickly respond? Arvinder, you're saying, I'll take Arvinder's response and then Shamika can respond. Why not mandatory, Arvinder? Why not?
Because it's not well researched enough. So you can't really force people to have it. You're going to have a lot of lawsuits, and lawyers are going to get really busy because everything and anything that happens, you sneeze after a vaccine and you're going to sue the hospital or the institute. So I don't think we're ready to make it mandatory. But one way of making people actually give up the hesitancy is to make it compulsory to produce a vaccination certificate if you travel or if you go into a public place.
COVID test, right? People would never get the RT-PCR test, and then you linked it to economic activity. Everybody did it.
Exactly. So you enter a stadium to watch a match or a concert, you have to have a certificate, or you travel, you have to have one. So that's the way of making people happy.
Shamika, briefly, if you want to respond, you're on mute, by the way. Just unmute yourself.
Sure. No, those are excellent. As a behavioral economist, I love these solutions. But fundamentally, what you're doing is you are restricting either mobility or activities of people who do not have it. And these are great ways to really, improve the take. But it's important to realize that infectious diseases are not like, non-infectious diseases. And therefore, the whole idea of a vaccine passport or making it mandatory for certain, activities, it's all a movement in the same direction. I think we can differ and disagree on the mechanisms. And being a loud democracy, of course, we'll have a lot of conspiracy. I completely, acknowledge that. But on the whole, I think point well taken. Yeah.
Okay, I want to close. Dr. Jameel, any last sentence that you'd like to just say on which vaccine? Will we be seeing more vaccines? What are the timelines? I know there's Johnson & Johnson's, there's Sputnik, there's, you're soon going to have Covaxin also available, but no consent form is needed. So this space is really opening up.
Yes, so there are a couple of other vaccines coming. I mean, as you know, Novavax has shown really good results, and Serum Institute has the capacity at least to make like 1 billion doses of the Novavax vaccine. Biologicals E is already in discussions with Johnson & Johnson. I think they have formalized an agreement. Dr. Reddy's lab with the Russian vaccine, the Sputnik vaccine. So we're going to have a bouquet of vaccines coming up. We'll be spoiled for choice.
And I would dare agree with Shamika that if you're still not taking the vaccine, if you have a chance to take it, it is actually pretty criminal because it doesn't really matter. You're not the scientist, you're not the doctor. But I think Arvinder has a craftier solution. If you just link the vaccine to economic activity, people will stop whinging. Leaving it there, thank you. This has been such a pleasure having a panel of real experts and learning so much. Thank you. And we'll have you back soon as we monitor India's vaccine rollout. Thank you very much. And thanks to our audience. See you tomorrow.
Thank you very much. Thank you.
Goodbye.
Thanks, Barkha.
Bye-bye. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.